Good morning to Ellen MD, Ellen Ayurvedic PG Intensive Coaching Center. Today's topic is identification of a kalamegha leaf. It is a very, very important in liver disorders. People think that with the drugs, in a specific manner, some of the drugs have been clearly mentioned as useful in case of liver disorders. So, based on the concept of Ayurveda, the drugs that are useful in case of liver disorders are useful in case of digestive system disease. Let us see what are the digestive system disorders like Ajirna, Agnimadya, Gulmadhi Vikaras. There is a link between respiratory system and digestive system, and the dravyas which are useful in case of Ajirna, Agnimadya, Gulma, Hodara, Yakrut, Pilhaj, Vikaras are useful in case of Swasa, Kasa, Pinasa, Pratisyaya, Tamaka Swasadi, Vikaras also. Generally, the dravyas with Tikta Katarasa, Katavipaka, Ushnavirya, and Lagurukha gunas are going to act as a Deepana Dravya, Pachana Dravya, Swasakar Dravya, Kasakar Dravya, Amahar Dravya, okay, and related diseases. So, in general, we can say as respiratory diseases and digestive diseases. Let us see now one of the important drug which is useful in liver disorders is kalamegha. Now let us see when you are going to garden, how to identify kalamegha. Just get the microscope and do the section cutting. If you are doing section cutting, what are the contents? Let us see. What are the contents? Let us see. Now let us see. So just you take the section kalamegha leaf and do the section cutting. You can feel presence of the upper epidermis and the lower epidermis. You can feel the presence of upper epidermis and lower epidermis. Upper epidermis, you see, lower epidermis. Upper epidermis is single layered. You can see it is very, very single layered. Upper epidermis is a very, very, you can see it is very, very single layered. Okay, and see now you can feel the presence of the upper epidermis is very, very clearly here. Below the upper epidermis, you can feel 2 to 3 layered palisade parenchyma. Below the upper epidermis, you can feel 2 to 3 layered palisade parenchyma. Okay, below the palisade parenchyma, in the center, towards both sides of the center, you can feel the presence of the spongy parenchyma. You can see the spongy parenchyma. Are you able to watch the spongy parenchyma here? See, what do you mean by spongy parenchyma? It is a type of palisade parenchyma, but air spaces will be more. But you see, in case of air, you cannot feel the cells are cylindrical in shape, and you cannot feel the presence of the air spaces here in case of palisade parenchyma. Right. In the center region, you can feel or you can observe the presence of xylem and phloem. You can observe the xylem and phloem. In the midrib region, what happens, you can feel presence of the collonchyma. You can feel the presence of collonchyma. See, you can see the blue colored content, structural contents are there. You are able to watch, this is collonchyma. Okay, now towards the lower epidermis, you can feel or you can find stomata. In nutshell, when kalamegha leaf is given to you for identification purpose in Mpharamcy Ayurveda, BAMS second year examinations or MD Dravya exams, this is simply telling Raseri Vipaka and Prayojyanga part used is one type of answer as per the requirement. But identification is identification. What are the paryaya padas? How far our paryaya padas are applicable to your morphology? You have to find out. Of course, our paryaya padas are applicable to morphology, anatomy, up to certain extent. Basically, we have to do the section cutting, confirm the identification, what are the contents in the leaf you are supposed to present to the examiner. Then only you will get the better marks and better scoring. See, this will help you wherever you are starting a pharmacy, wherever you are going to garden to find the kalamegha leaves. See, kalamegha also available, but today some people are using for the purpose of kalamegha, svertia, chirayata, they are using. So, what is happening today in the system of Ayurveda, we are purchasing the drugs, through the authorized centers. If you are purchasing, we can ask them whether from where you are getting, what is what, all the things you will have an idea. But being doctors, at least we should know the drug identification procedures. And this is specially for the community students community to identify the kalamegha leaf. Now, In case of any, if you are having any doubts, just you find out. Simple upper epidermis, lower epidermis, and midrib region. In the midrib region, you can find presence of the xylem and phloem, but in the midrib region, in the region of the above the epidermis, you can feel colon-chyma tissue. You can feel colon-chyma tissue. Thank you. Today's class is over. Identification of kalamegha. If you are having any doubts, Dr. Simhadri 9014141722, Elena Ayurvedic PG Entrance Coaching Center. Thank you.